In Kenya, truth be told is that our government went very fast into locking down where they saw these are the high-risk areas. Schools go back, schools closed. The hospitals, let's reduce movement into hospitals. Prison facilities, let's contain the prisoners within the prison facilities.
Yeah.
Reduce visitors. In fact, ban visitors to prison facilities. Right? All that. And by and large, prison facilities, we have not seen many cases in those prison facilities. We have not seen many cases in all these areas. Right? So we're going to speak to the government, this cabinet Chief Administrative Secretary in the Ministry of Health, Dr. Rashid Aman, who is joining us now on the line. Dr. Rashid, good morning.
Good morning. Good morning.
Thank you very much for speaking to us, and welcome to the Situation Room on Spice FM.
Thank you.
Good morning.
Doctor, we start off with, we've been seeing now, we are in the triple-digit cases per day. 1, 2, 3 the day before yesterday, 1, 2, 4 yesterday. And you've been saying when you're giving the briefing is that this clearly is an indication that we have community transmission. It's still ongoing community transmission, and the measures that have been put in place, some are working, and you still have to keep reviewing and seeing what's working, what's not. As we go towards the 6th of June, when the dates for all these measures, some of them are expiring, and we're expecting some feedback. What would you like to say is, what have you seen as the National Emergency Response Committee? What have you seen working, and what are the challenges that you've encountered so far?
Well, first let me say that when we say community transmission, it's no longer an issue of whether we have community transmission or not. I think we have it. That's why you see us picking up positives all the time.
Yes.
The number of positives that we are able to pick on any day is also a function of the scope of testing that we do.
Yep.
You can see the correlation that the more testing we do, obviously it's expected that we'll pick up more positives.
Yeah.
Isn't it? And the reason why we have moved up to double digits and so on is partly because of the expanded scope of testing that we are doing, the targeted testing that we are doing, and all of that. So that is expected that numbers will increase. But beyond that, what does this information tell us? This information tells us, number one, that community transmission is established. That we go to any place around the country now and start doing some level of testing, targeted testing, we are likely to pick up.
Yes.
But key is how many are we picking up in any particular area when you segregate these places. So those areas which we segregate, and we tend to go in those places, are places where we feel that there's more transmission there, simply maybe because those were areas that initially the contacts of people who were positive were, because you know how this thing is passed on from every person may possibly be able to pass it off to anything from 2 to 5 to 10 people, depending on the level of contact. So our testing strategy is also guided by the contact tracing that we do, those pathways that we develop that tell us these are areas to watch out for. So we go in and do that testing there. And indeed, if we find high numbers, then a measure is taken, is put in place. Examples: what happened in Kilifi, in Mombasa County, Nairobi County itself, and closing off of these counties, and then specifically within some of these counties, you go to particular areas which are clusters. Vita, for example, Old Town in Vita in Mombasa, Isli in Kamkunji here in Nairobi. You put in those measures because you think those numbers you're not too comfortable with them as they begin to rise. So testing is key for us, and the more testing we do, the more we are able to unearth, and the more interventions then specific in particular areas that we can put in place. I believe that these measures that we have been, repeatedly encouraging Kenyans to observe are important. These are the measures that have worked in other places. This is an infectious disease that spreads so fast. Its infectivity is very high. In other words, the ability for it to be able to spread to other people through very simple procedures of being close contact, the exchange of air, through either sneezing or even simple breathing sometimes, or touching surfaces. It's unprecedented. I think there are a number of viruses that, of course, are spread. Respiratory viruses are spread through these systems, but this one is just too, it spreads too easily and too fast.
Yes,
and that is why we must have these social distancing, physical distancing measures, the hand washing, the hygiene. Those interrupt the transmission cycle of the virus. These viruses, most viruses, by the way, apart from a few, actually do not have any treatment, complete treatment that will stop them in their tracks. And coronavirus is a new virus. We are learning more about it by the day. We need to contain it, and the best way to contain it is to have these measures that have been put in place. And they do work. It's been shown in other countries they do work. If they are observed diligently, they will work.
Is there a shortage?
Yes.
Doctor, is there a shortage of testing kits in the country? Are we going to get into that rut, or are we looking at that increasing?
We are working as a government to try to stabilize that supply chain. There is indeed a shortage worldwide, not only in Kenya. There is a shortage worldwide because this is a pandemic. Every country in the world is affected, and you can imagine the demand, unforeseen demand, because these systems have been there before, the test kits. Basically, the instruments and some of the components of the test kits have been around for a while, used for other tests, you see. But now they're largely being consumed for COVID-19 testing. So you see, they are overrun in terms of supplies. The manufacturers have to scale up. Countries where these products are manufactured are first taking care of themselves, and other countries. So countries like ours, low middle income countries, we are at the end of the queue.
So we get bulldozed basically out of the queue.
We're at the end of the queue, but we are trying through even our continental organization. AU has been in the forefront, actually, pushing through the Africa CDC, pushing for these allocations for African countries. And I have seen the situation slowly improve, because many of the manufacturing companies have scaled up their production lines and increased it, which is going to improve with time. But we will continue to face shortages now and then.
But Dr. Rashid,
the supply line is not steady.
What we've seen in the last couple of days, it appears like we have a new biting shortage. In terms of, the number of tests that we are doing now has even reduced. Last week, we had got into a number of days when we were doing at least 3,000 tests. Now we are doing less than 3,000 tests on a daily basis. And then there are also those complaints from people who are expecting to get their test results. Their samples have been taken and the results are not coming back. And there's a backlog at KNH and Kemri. What's causing this?
It is the supply chain that will cause this backlog. The supply chain will cause this backlog. What we're doing is, in order to be able to do large-scale testing, we shifted to a mix of testing methodologies. We are using some high-throughput instruments that we have within our facilities that can test large numbers of tests. These instruments are closed systems, closed in the sense that the reagents that go in there are specifically prepared by the manufacturer of that instrument. Some of these instruments, for example, is what is called the Cobas, the Roche Cobas instrument. Roche prepares the commodities that are required for that. And we receive, when we place an order, say we received, I think, 18,200 of these tests. We start applying those quickly. That is when our numbers started going up to 3,000. We are able to sustain that for, 2 weeks maybe. Then we run out of those. By the time we are running out of those, the resupply has not come in because of these problems with the supply chain globally. So we are going to see these lulls or lowering of testing as we go along. But we are also building up on the so-called manual testing. where we're using machines that require a little bit of human processing time of samples. I think the more because these are smaller machines, there are machines that are portable, easily can be put in a particular point. So really, I think part of our strategy too moving forward is going to be to try to build up this capacity of testing and move it into those places where it is required. In other words, try to decentralize and not just rely on a central throughput system, because it could give you problems at some point. So we have this mix of strategy that we are working on to try to address how we can be able to continually maintain our level of testing. But again, all of this is dependent on the supply chain. But I think once you diversify your supplier, people who are supplying you with the commodities, I think you're also able then to be able to deal with some of the problems in the supply chain.
Dr. Why not for the fact that we are not seeing very many cases in this country requiring intensive care? Why not for that fact? Don't you think that those supply chain challenges would have actually cost us our fight against this disease? Basically, what I'm saying is the kind of response that we are seeing human beings in Kenya giving to the virus is what is fighting this disease more than all these other things, like, testing is not really our testing capacity is compromised, and everything else has challenges.
You see, testing is important because it's only after testing that you know there is a virus present, right?
Yes.
So testing is key. However, I know what you're talking about. You're basically what people are talking about and seeing is the trajectory of this disease different in African countries? What is happening? Why are we, we know that about 70 to 80% of people who we when we test have the virus are not critically ill people. A large number of them are asymptomatic. They do not display any symptom, but yet they are carrying the virus. They may not even know they're carrying the virus. And they may spreading the virus. So I think that there's some level of comfort in what we are seeing, but I think it would also be, we don't want to be complacent and start, ascribing reasons why this is that will make us complacent, because we need scientific evidence. This thing is being looked at very carefully. A body of knowledge will emerge as we move forward. Are we handling this disease in a different way in African countries? Are factors such as immunity, environmental factors, many other factors, people have even talked about BCG vaccination in the past, and so on. Do these factors, are they actually associated with the pattern that we are seeing? We don't know yet.
Right.
We don't even know yet where we are really on this curve. Is this curve going to hit an exponential at some point?
It's interesting that you say that, Dr.
We need to be very cautious and continue doing what we think works.
Okay, so if we're saying that we don't know, I mean, and that's where you're ending this last statement on, is that we really don't know where this thing is taking us. Now, if we want to put that against what would a lot of Kenyans are speculating on now, and the fact that maybe a conversation will be had from tomorrow about opening up the economy, but we're still asking Kenyans to do the same thing that we've been asking them to do in terms of maintaining social distance and physical distance and washing hands and wearing masks, this, that, the other thing. And we are looking at the possibility of the economy opening up again. And we don't know. Is it possible then to have these decisions made on something that we don't know?
The truth of the matter is that this is a pandemic. While it is primarily a health issue, it is affecting livelihoods, isn't it?
Yes.
True. It is affecting, it is affecting the economy. It's disrupting almost every the way we are used to in life, everything almost. So, and it's not an easy decision-making process to determine where do you strike the balance, right? Because it has to be a balance. It has to be a balance that can ensure you that you are able to manage to some extent, perhaps not even fully, the containment of the virus, but at the same time, you are not completely destroying the means of livelihood of the population.
Yeah.
And it's a very difficult decision that cannot be informed by, any evidence, because that evidence may not be available. We don't know what trajectory that evidence will lead you to. That is why even models can give you an indication, but models are not the gospel truth in terms of telling you what might happen.
Yeah.
So there has to be some level of political and other decisions that may have to be coming while maintaining a balance. But the balance is delicate; it has to be maintained. If you ask me if you look at what's happening in other countries, take the U.S. for example.
Yeah.
They grapple with the same thing. Every country has grappled with this issue.
Yeah.
So what are we going to kill our economy? What do we do? Maybe we need to have some level of gradual, relaxing of certain measures, but at the same time, understand that you could have in those countries what we're seeing is what they're calling spikes, isn't it?
Yep.
Resurgence of infection.
Yeah.
Be prepared for that as you do this, and try to keep striking that balance. And I think that is what is likely might happen in our case as well. That we may see perhaps relaxation.
So it sounds to me
I really
like
don't know, because I'm not privy to some of those discussions, that lead to those decisions. But just as we have seen in many other countries, economies are hurting, and something needs to be done. We're moving to almost 3 months, isn't it?
True.
Since, over 2 months are over, at least 2 months.
Yeah. Since we got our first case.
We're put in place. Yeah.
Let's talk about the care of those people who have tested positive in the isolation centers. And yesterday, the CS started intimating that you may want to start rolling out the protocols on home-based care.
Absolutely.
Because now what you're saying is you've seen the number of people who are coming to the facilities, and they are not deteriorating in terms of their condition. They are all remaining asymptomatic until they go home. But if we go into that, enforcement of home, if we roll out home-based care, how are we going to enforce that? How are we going to make sure that the people who test positive and we tell them stay at home so that you don't spread the virus are actually going to be able to stay at home, bearing in mind the knowledge that we have from the quarantine, the quarantine calls?
Yes. And that is where, when the CS was talking, and we have also stated before, there has to be a level of personal responsibility. People now understand. The public should by now understand the things we have been preaching, that this is something that has to be done by every Kenyan taking on a responsibility alongside government authorities and working with the government authorities. Allowing people to go home, I think, has many advantages. It has the advantage of, one, decongesting these facilities so that those who really need it, those who clinically progress in disease, have a place in those facilities. It makes no sense to put somebody who is almost unaffected, to occupy a bed when another person might need that bed.
Need later.
But this person who you are planning to move somewhere else is still a danger in the sense they can spread the virus.
Exactly.
Right? And so that person, I think there has to be a level of responsibility on the individual, on the community, on the family of that person. You need to understand, even if that person, you are able to put him in in his home, he has to understand. The family has to understand. They need to be protected from him. He needs to understand. He needs to protect the family because he is a source of the virus.
But personally, Dr. Rashid,
that is something we need to impart on Kenya.
Dr. Rashid, you're a Kenyan. We are Kenyans. We know one another. Do you have confidence that this is going to be effective? Asking people, when you test positive, just stay at home and contain yourself within a certain environment.
What we hope to do is even government can use some of its machinery just to monitor if this can be done, because we have systems. We have in the healthcare system we have, for example, community health workers, at those mashinani levels, people who work with the ministry community, workers belonging to that community who know every household. If we activate those community health workers, if we activate our security system at that level, which is the Makumi system and all of that, I think we have a chance that this thing can work. And if we then raise the sensitivity and knowledge of people at that level on what it means when you're sent to quarantine, not only for that individual, but for his family, for his family, and then community at large. I think it is possible.
Okay.
And it is the only way that we can go, because we will be overwhelmed if we start putting, and the numbers keep rising, and we start occupying these beds when, critically sick people might need it. Yeah. So we need, and I want to plead with you as media, the Fourth Estate, because you have a big role too in educating and informing people on how to behave if we go that way and begin to implement. I think it's not an if, I think it's a question of we will do it, and it is coming, and people need to be prepared, and people need to be educated, and I think there is an opportunity for you to help us.
Sure, that's very clear. Dr. Rashid, now on the point of curfew, and I know that's a contention that a lot of people had, to ask the question from your point of view, where do you see this as really being an intervention measure to curbing the spread of COVID amongst Kenyans, and saying that, all right, if you're at home for a certain period of time, what we do is that we interrupt the progression, and how exactly does that work?
I think experience has shown, because you see, curfew is almost standard procedure in this response. Almost every country that has this virus has imposed one form or other of curfew. Extreme curfew, of course, 24-hour curfew is what we call the lockdown, like what happened in Wuhan and other places, isn't it? And many other countries. So that is necessary, because the moment you interrupt the engagement of people, interacting with each other, you have been able to strike a blow against the virus. We have a partial curfew.
Yes.
And the reason we have a partial curfew again is because of that delicate balance I talked about, isn't it? That delicate balance, because we are a country in the developing world. Our circumstances are very, very different from a country like the US or the UK or Italy or even Korea, isn't it? The way the lifestyles of people there are entirely different, isn't it?
True.
We cannot apply exactly what is being done in those places in our setting, because then we would be creating much, much bigger socio-economic problems, isn't it? But we have to have that balance. The curfew, we have seen, is working, because it does stop that movement of people. Some of the places where transmission is usually very high is in places where people gather after hours, entertainment facilities. Places like that. By putting in that curfew, you actually stop that.
Okay.
The other fact that we must also understand is that maybe the reason why we are seeing what we were talking about earlier, that we have different trajectory in Africa on this. In Kenya, our population demographic is very different. We have a youth bulge, isn't it? Most of our those are the people who are active. Those are the people who also will be symptomatic. Those are the people who are going to be patronizing many of these facilities,
the social places,
during those hours. So I think that does work, because if you interrupt that, then you're still able to at least give a blow to the virus.
To the virus.
Dr. Rashid Aman, Chief Administrative Secretary in the Ministry of Health, we thank you very much for speaking to us today. And a good job that you are doing at the ministry and the NAC, and we keep urging you to do the right thing all the time for the benefit of the people.
Thank you.
Thank you very much,
And once again, I'm appealing to listeners and fellow citizens, this is a war that we have to fight together, and we will encounter very many challenges and inconveniences. We have to make sacrifices, but it's what we have to do if we are to beat this virus.